Okay, so in this video, I would be doing RhoGAM Administration. So the first thing that I would do, I would check the doctor's orders, and I would make sure that the mother is RH negative and the fetus is RH positive. Once I determined that, I would complete a ID card and obstetric form portion of the card. Then I would go down to the lab and I would obtain the RhoGAM. And the RhoGAM usually will be a pre-filled syringe. So once I get the RhoGAM, then I'm going to check the lot number on the RhoGAM to the lot number that's on the form, in the form with the lab. Okay, then so I'm back from the lab, and now I'm with the patient. I'm going to explain the procedure that I'll be doing. I would allow questions. I will allow the patient time to ask questions about the procedure. And then I would get ready to administer the medication. Before I administer the medication, I'm going to wash my hands, put on gloves. I'm going to do the 6 rites of administration to make sure I do all of my checks, and I would check the control number again against the form, and also check the patient's identification against the form. Okay, so then I would administer the RhoGAM, and with administering the RhoGAM, it is an IM injection. So therefore, you would choose your site, which would either be the deltoid, or it would be, you would either choose the deltoid, or you would choose the I can't think of the name, the side of the hip, between the greater trochanter. And when I'm administering that, I'm gonna help my patient get on the side. I don't know if I'm supposed to be pretending like I'm administering or just going through the steps, but I'm gonna go through the steps and okay. So I will help my patient get on a comfortable side. I would do the steps that I would need to do to administer the RhoGAM, which making sure that I do the needle at 90 degree, find my location, palpate, make sure no bruises. When I administer, make sure I administer at 90 degrees. Also, before I administer, make sure I pull back to make sure I don't hit any veins. And you'll know that by if it's any blood return or not. So if it's no blood return, then you're going to administer the medication. And with the pre-filled syringes, is usually like a safety lock. So you wouldn't just pull the needle out. You would hit the safety, and it would retract the needle. So therefore, like, the needle is never exposed when you remove it. Okay, and once I've administered the shot, I would give the patient a copy of the card, and I will also give them a RhoGAM pamphlet. Then I would return the form to the lab. If the patient refused the RhoGAM shot, then I would have the patient sign a refusal form, which releases the hospital of any liabilities. And okay, then I would apply the RhoGAM sticker into the patient's chart. I would apply the RhoGAM sticker into the patient's chart, showing that it was given with the lot number, and then I would document the process. I would document you know, the route, the time, the date, how the patient responded to the procedure. Yeah. Yeah. And once I document, then I would, you know, get rid of all of my my trash, make sure I dispose of the needle in the sharps container, and then I would make sure my patient's in a comfortable position, make sure my patient has all of, you know, her supplies and call bell and things like that near her, check and see if she needs to go to the bathroom or anything, and that would conclude the video.